Right. Good afternoon, everybody. I'll start with some good news. We've no further positive cases to report outside our managed isolation facilities. I would add that's not unexpected. The case was the case that we've been dealing with this week, very low exposure risk. And further tests have also come in that show that the second case has returned a negative result on their second test. So I'm going to ask the Director General to provide you an update on the case and on the usual daily update. Then I'm going to get into a bit more specifics around vaccines and particularly around the potential early access criteria for vaccines, and then we'll open up for questions. So I'll hand over to you, Director General.
Thanks, Minister. Kia ora koutou katoa. So, as the Minister said, some encouraging test results in overnight on our case, which we'll call Case A, as we do with each new incident. So the whole genome sequencing has demonstrated a clear link between this case and their workplace. The results tell us that it is the B117 variant, which was the one first identified in the UK. And this case is a close match to the genome sequence from a returnee from overseas who was staying at the Grand Millennium between the 13th and 15th of March. The returnee's infection was detected at day 0 testing, and that person was then transferred as per the protocol to the Auckland quarantine facility. So this provides a high level of assurance, a reassurance that our case A, their infection was picked up in the workplace rather than elsewhere in the community. In terms of the household contact, as the Minister said, the retest for that household contact who had the weak positive test result initially has returned a negative PCR test result, and the serology is also negative. This pattern of results could indicate that the first result was a false positive, or that it was an early and or fleeting mild infection that is now passed. So while we just wait until further investigation, which will mostly mean repeat serology testing, just to see if there's a change in any antibody levels, we will be continuing to keep that person as a case under investigation. And in fact, whilst they're not a confirmed case, they are currently at the quarantine facility while they remain under investigation. We just still have the one location of interest, and this reflects the fact that our case had been not really out and about in the community in the few days before they tested positive. The only place of interest is the Countdown Mount Roskill between 3 and 3:15 on Saturday the 20th of March. The fact that the case used the COVID Tracer app meticulously was very helpful, and we were able to send out a notification to others who had scanned in when they went to the countdown during that period. So again, you don't know where or when, so it's helpful to use the NZ COVID Tracer app wherever you go. So just a little background on exposure events. These are distinct times and places where COVID-19 is judged to have been possibly transmitted from person to person. And our determination of whether a place there may have been an exposure event, it factors in the potential infectious period of the individual, the duration of the visit, and the nature of the visit. There are some places that Case A went that have not become locations of interest or classified as exposure events because either the correct infection prevention controls were followed, remembering that Case A is a border worker, or we know everyone at those exposure events who may potentially have been exposed, and therefore they are able to be contacted and appropriate action taken. And there were some places that were investigated as exposure events, but the investigation has shown there were no people who were exposed at that place. I mentioned yesterday that the infected returnee who we have now who I mentioned earlier, who was linked to Case A, was staying at managed isolation facility, the Grand Millennium, before Case A received their second Pfizer vaccination. So for many people, the vaccine stops them getting COVID-19 at all. For others, even partial immunisation provides some protection so that if they do become infected, the infection is quite mild. And we're seeing in this case, our Case A is still asymptomatic throughout. So what has happened here is something that we would expect. There's nothing unusual. The viral has been passed on, but with less a less nasty illness in the person getting it. As the vaccination has provided some protection for that. And the real value of these vaccinations is that they do protect many people from being infected, and then those who may be infected are much less likely to require hospitalisation, and all the studies have shown that these vaccines are very highly effective in preventing serious illness or death. But full vaccination is important. For the Pfizer vaccine, that's 2 doses 3 weeks apart. And this case also emphasises the importance of us continuing our border measures, the infection prevention control procedures in our managed isolation facilities, and the ongoing regular testing. So I do want to thank our border workforce, including this person who had shown up for vaccination, has had both vaccines, was having regular testing, and was of course in the course of their daily work using appropriate infection prevention and control. And finally, just an update on the day 12 case we had at the Grand Mercure, which I spoke about yesterday briefly. The Auckland Public Health officials have reviewed the 23 other returnees who were on one of the 2 buses to an exercise area with that person whose test returned positive, was reported positive while they were out exercising. As a precaution, none of those people are symptomatic, but as a precaution we are extending the managed isolation stay for those people. Some are considered to be close contacts and will need to spend an additional 14 days in managed isolation from the date of that potential exposure event, while others it's just an additional 5 days. This will provide us with assurance that there is no additional risk to the public, and I want to sincerely thank those whose stays have had to be extended. Personally thank them, and I'm sure all New Zealanders appreciate their patience and their willingness to support our efforts to protect New Zealanders. Thanks, Minister.
Thank you, Dr. Bloomfield. We've now, turning to our vaccines, we've now done 41,500 doses of COVID-19 Pfizer vaccine. They've been administered. By next Tuesday, that's the 30th of March, we're expecting there to be nearly 50 clinics for vaccination open throughout the country. We have around 1,300 vaccinators who have completed the Pfizer training. So far, 95% of all of our border and MIQ workforce have received their first COVID-19 vaccination, and a reasonably significant number of them have received or are scheduled to receive their second and final dose over the coming weeks. This means that our focus can now shift more firmly to ensuring that our frontline healthcare workers have early access to the vaccine, and that is already underway and will now start to ramp up. This group includes staff who have direct contact with patients, people who could potentially come into contact with COVID-19 or are working with COVID-19 samples. These workers have a high risk of getting COVID-19 and therefore need to be protected, or I should say a higher risk of getting COVID-19 and therefore need to be protected. I'd also like to note here that anyone in a border workers family group, immediate family group, household contacts, who hasn't had their appointment confirmed within a week of their details being submitted should contact Healthline on 0800 282 926. So if you're a border workers family member, immediate household contact, your details have been submitted, you haven't got an appointment, call Healthline and seek further advice. They will tell you where you can go to get a vaccine. The government made further decisions this week about exceptions to the vaccine rollout plan that we announced 2 weeks ago. We've confirmed quite strict and a very carefully considered criteria for early vaccinations for people who need to travel outside of New Zealand on compassionate grounds or for reasons of national significance. A very high threshold for early access to vaccines has been set, which will balance compassion with the need to avoid potential queue jumping ahead of at-risk groups where there is no strong justification for that. Even before people will be considered for early access to vaccines, they'll need to satisfy a series of criteria, including being a New Zealand citizen, resident or visa holder, needing to travel before the 31st of August, and having already made arrangements to return to New Zealand after their travel. They will also need to ensure, as far as practically possible, that they are able to receive both doses of the vaccine before their scheduled departure. The compassionate grounds that will be considered for travel overseas include needing to provide critical care and protection for a dependent, accessing critical medical care that is not available in New Zealand, and visiting an immediate family member who is dying. It does not include reuniting with family, attending a funeral or memorial service, or attending a school or university. National significance overseas travel will include representing New Zealand in an official capacity, at significant international events, and in an official non-government capacity. The key yardstick here is that people are travelling in an official capacity and ensuring their participation is in our national interests. We expect these requests will be made by the appropriate agency or association on behalf of individuals, not by individuals themselves. That's for the latter category. It will not include private or recreational travel. The final consideration is the level of risk travellers will be exposed to around COVID-19 in their destination country. Underlying these decisions is a fundamental recognition that while there are legitimate and urgent reasons to travel overseas, it's also in our interests to ensure that New Zealanders are protected against COVID-19 to the best extent possible for when they return home to New Zealand. Further information about the criteria and the application process for advanced vaccines requests will be made available this week. Applications will open on the 31st of March. Finally, you might have seen that we have made the decision to extend the period people must stay in New Zealand from 90 days to 180 days if they are to avoid paying the costs of their stay in managed isolation. This follows our decision a few weeks ago to increase the cost of managed isolation for temporary visa holders. We're doing this to ensure the sustainability of our managed isolation system. Now, happy to open up for questions.
Minister, why have you deemed visiting an immediate family member who is dying as more important than the funeral of an immediate family member?
Obviously, funerals are a very difficult time for families. I think there is something about those precious final moments that make people's desire to see those family members before they pass away very, very understandable. I do know that people have rescheduled memorial services and funerals to when people are able to attend them.
If someone has died suddenly, that is very traumatic for someone, and they wouldn't have had a choice to see them.
Look, I do understand we have to draw the line somewhere, and ultimately this was where we drew the line.
Since the vaccination sort of path or course takes a while, you get a first shot, then you have to wait a few weeks and get a second one. What happens if someone gets an exemption to go see a dying family member and they do pass away, before that person is fully vaccinated? Do they still get to, get the second dose of the vaccine and travel overseas?
No, once you've started your course of vaccine, we want you to finish your course of vaccine. So, yes, you would still be able to get your second dose because, our processes are very much designed to ensure that people, once they've had their first vaccine, get their second vaccine 3 weeks later.
Does this mean you'll vaccinate the black caps?
Look, they'll have to make an application. It will depend on what sort of events they were participating in as to whether they fit the national interest criteria. But certainly, our expectation is that the Olympians would be eligible under the national interest criteria, and a national sports team participating in a significant event would also meet those criteria. My understanding is that we're talking about a few hundred potential athletes and sports people who might fit the category. So it's not a large group, but certainly where that national interest or national significance criteria is met, then yes, they would be able to.
I guess the key word there is significant, isn't it? Because the World Test Championship and the Olympics and Paralympics are obviously significant, but is canoe polo, is tramping, what does it matter whether you're in a big sport or a small sport?
Yes, it has to meet that national significance criteria. So obviously those sports that everybody is hanging out to watch on television, for example, are more likely to hit the national significance criteria than a school sports team going to compete with someone else around the world.
Is there a vaccination?
Just on some back of the envelope calculations. So of the 3% you're expecting will be affected by the extension of the MIQ fees. So say for example yesterday 358 people arrived. 3% of that is 10, so that's an extra potentially 300 spots in MIQ a month. What are you going to do with those extra spots?
Look, we do re-release vouchers at short notice, and so you'll note that we try and optimise our use of the MIQ capacity. So where people are cancelling out, we'll typically re-release those vouchers if there is time to do so. I want to point out that it's not an exact science here. That's not because, for example, if someone released their voucher, cancelled the fact that they were coming the day before they were due to arrive, we may not be able to re-release that voucher because by the time someone else picked it up and got here, they would be several days into that period of time, and therefore we can't just ask someone to leave after 10 or 12 days because their room needs to be occupied by someone else. So there's careful management goes on to ensure that anyone who gets a voucher, we can actually accommodate them for the full 14 days that they need to be here. But we do re-release. At the moment, we're sort of sitting at around our desired occupancy level. That starts to tail off in the next few days. So you will see that further last-minute vouchers will be released over coming days.
So you won't be using them for, the healthcare workers' families who are stuck overseas and they want to come here to New Zealand?
At the moment, those people can still apply for a voucher, the same as everybody else. One of the things that I have asked for work to be done on, and it has not been done, and I don't have any announcements to make on it other than that we are working on it, is whether, given we now know we're going to be doing this for a reasonable period of time longer, whether we need to also build in a wait list system for MIQ. That'll take some time to develop, but we are exploring whether that should be added, now that we know we're probably going to be doing this at least for the rest of the year.
Say to Māori health providers and experts who look at this criteria for early vaccinations today and wonder why early vaccinations aren't being made available to Māori who have poorer health outcomes?
Well, certainly if you are fitting within the poorer health outcomes, then you are getting earlier access to vaccines than others. That's exactly what the sequencing framework is designed to achieve.
And when exactly is that rollout expected for those?
Well, it depends on where they fit within the tiers, and so if you look at someone who is a higher risk and living in South Auckland, for example, they're going to get earlier access than someone in an area where the risk is that much lower. So we have very much made the decisions for the bulk. We're talking about a few hundred people here in terms of who are likely to meet the exemption criteria, not tens of thousands. The vast bulk of the vaccines are are allocated using the allocation framework that we set out 2 weeks ago.
Those few hundred, though, will they be able to apply for those early vaccines as early as tomorrow?
No, it's like I said, the application process opens on the 31st. Yes, that's right.
So, but those Māori who are, say, in South Auckland, who do have poor health outcomes, will they be able to apply on the 31st? Will they be able to get their early vaccines from the 31st?
Look, only the people that meet the criteria that I have just set out will be able to access vaccines under
Around
this
the timing,
criteria.
the timing
In terms
is what I'm
of
getting
the remainder, which is the vast bulk of New Zealanders, they'll be able to access the vaccines when they come up on the sequencing framework.
Is the vaccination schedule, are we on schedule? In the graph that was released last week, we need to be roughly administering more than 10,000 a day. You said yesterday we're in the low 2,000s. Of course, you expect that to ramp up. But where are we right now? Are we actually still on schedule or are we behind?
Yes, we're broadly on schedule. One of the things that the team have been doing in these early weeks, and I think I've gone through this a little bit before, is making sure that they're smoothing the administration of the vaccines over the first half of the year to ensure that we don't reach a point where towards the middle of the year we start to run out before we ramp up with the really big campaign in the middle of the year. So that's just involved some resequencing at the beginning to make sure that as we ramp up we can sustain it. What I don't want to see, for example, is that we get to doing 10,000 a day and then we find that we've only got enough vaccines left for a period of time to do 3,000 or 4,000 a day, because then we'd have to scale down again. So they're working on making sure that they're phasing the ramp up so that as we ramp up we keep ramping up rather than having to ramp up and then ramp down again.
I just wanted to see if we are where we are meant to be, because the Ministry of Health won't release the numbers behind that graph. Are we supposed to be at about 10,000 a day now?
Can I comment, Minister? So no, we weren't expecting to be at 10,000 a day. So far, I mean, two key indications that we have delivered about 93% of where we planned to be so far, but that is continuing to scale up this week. And I think a really important figure, and one I would like to emphasise, is around that 95% of our border workforce have accepted the vaccine, which is extremely high, and I think sets a great precedent for our further rollout.
Only 3% of where we want to be. Aren't we slightly behind the schedule?
Slightly behind, but it's ramping up every day, and there are additional sites coming online every day right around the country.
I just want to...
Part of that because people are refusing the vaccine.
No, not at all. You can see that 95% acceptance rate, I think, would probably exceed what it would be right up there what our ambitions would be. And it's increasing every day too. So 95% have had their first dose and already quite a proportion have had their second dose.
I think it is fair to say, though, that in this early phase we've been able to refine some of our systems based on human behaviour. So what we found in the early weeks is that we saw a number of booked appointments people weren't arriving for, but then they were just walking in at a different time. So we've been able to make sure that we're well prepared for the human behaviour aspects that go with this as well, so that we're not turning anyone away from being vaccinated when they're eligible and so on. So it has been a good opportunity to make sure that all of that's refined and worked through, so that as we ramp up to a much bigger number, we know that all the systems we've got in place are sustainable. So I'm reasonably comfortable at this point. I think the fact that we've got, by next week, 50 clinics throughout the country will be open and operating. What we know is that when a new vaccination site opens, it takes a few days for them to ramp up to being able to do the maximum. They tend to start quite cautiously, understandably so, until they make sure that all their systems at that site are running smoothly, and then they start to produce the bigger volumes.
The Cook Islands Prime Minister's visiting over the next week. Will you be meeting with him, and what talks will be happening while he's on the ground in terms of the bubble with the Cook Islands?
Yeah, so I am meeting, I believe, with him on Monday. I think the Prime Minister is meeting with him late this week. Of course, the travel bubble and vaccinations are likely to be two topics of conversation that both the Prime Minister and I have as well. There are areas where the Cook Islands and New Zealand have some mutual interests that we want to make sure we're all on the same page on.
How keen are you to make the most of him being on the ground in terms of progressing those sort of talks?
Oh, absolutely. It's a huge opportunity for us to have some really good discussions.
Just on how the cleaner got infected yet? Did they clean the returner's room?
That's being looked into now. We've now got a really clear lead. The result just came in at 8 o'clock last night. So the CCTV footage and the access card records are being gone through at the moment.
Sorry, about 10 months ago, the government was forced into a humiliating time back down in terms of access to funerals, growing cap sizes so people could attend. Surely, with these criteria, you're going to be having to doing something again in the next fortnight when the outcry comes that people can't attend funerals with the vaccine.
Look, I do understand that when a relative who is overseas passes away, that's an incredibly difficult time for family members. I have someone myself who I know very well, who had to attend his elderly mother's funeral via Zoom. That's been happening for a year now for families. And I do want to acknowledge, outside of the debate around vaccines, that this is a really difficult time for families who find themselves in grieving. And we can do some things to try and make sure that they can spend time with loved ones before they pass away. But if we were to extend that out further to funerals and so on, it's potentially a significantly larger group.
Dr. Bloomfield, while I have the floor, now that you've confirmed the categories for compassionate grounds and national significance, why is it that you've chosen to recommend that sports groups like the Black Caps get priority access to vaccine?
I didn't recommend the Black Caps specifically. We provided advice to the government. As the Minister pointed out, there were two sets of criteria, two groups that Cabinet had already indicated when they made the decision on the sequencing framework 2 weeks ago. One was around compassionate exemptions and one was around national interest exemptions, and we put through advice, and I think as the Minister's outlined, the criteria are very tight. And I think in part that is to make sure there are balances right between being able to offer protection where there are specific circumstances, but also make sure our focus remains on vaccinating our populations here. That's where we want to put our effort.
On that
Sit down
particular
with you.
question,
Joe,
Dr. Bloomfield.
yeah.
So, in terms of the criteria, who did which bit? Like, did Cabinet decide the compassionate bit and the sporting bit, and then you provided advice on the specifics that we're now seeing today? Can you just explain?
The cabinet, the cabinet made these decisions. So these were cabinet decisions.
Then, Dr. Bloomfield, what did you say was appropriate?
So the Ministry of Health worked with other agencies to come up with the criteria about who, with a range of options actually for Cabinet, and our recommended option around the criteria, which was to keep these groups as quite tight, but ultimately the decision was Cabinet's, and that's the one the Ministers communicated today.
Luke.
Who did you consult with then? So, which sporting bodies would you?
Oh, no, with other government agencies. Rest assured, a range of groups and from across society have been communicating with the Ministry of Health over the last few months about access to the vaccine, less about travel overseas and more about where they might fit in the onshore sequencing framework. But again, Cabinet's made those decisions, and our job now is to implement those.
Did any of those agencies, express an inequity there in terms of the funeral versus the dying relative?
I don't have that detail.
So I should note here that Cabinet has also indicated that where decisions are being made around what's nationally significant, that Sport New Zealand should be consulted with regard to decisions around sports, and where there's culturally significant events, should that come into being, the Ministry of Culture and Heritage should be consulted on those as well.
Is that for a question about
Sorry, what was
whether
your-
anyone raised the inequity in terms of the funeral versus someone
Equity
dying?
was absolutely a factor that Cabinet considered. We do note that whenever you create a framework like this that gives some people the ability to access the vaccine early, that there will be equity questions about that. That was certainly something that was well canvassed in the Cabinet discussions. Luke, I will come to you.
Things. Firstly, for example, if the black caps apply and were to get approved, and everyone got both of their vaccines, just confirm they would still need to quarantine when they came back to New Zealand?
Yes, we've made no decisions to remove quarantine for vaccinated people at this point.
Yep, and secondly, Dr. Bloomfield, you were talking before that you're running at about 93% of where you want to be at the moment, but that it's scaling up all the time. Do you have a sense of the time frame over which you might sort of catch up to 100% based on how you're going at the moment? 2 weeks' time, things have ratcheted up and up.
So the 93% was against what we had modelled, and we model out into the weeks ahead. But we're actually constantly adjusting that because we get plans from the District Health Board, and sometimes the aspiration actually goes up because the DHB plans say actually we're opening more sites in the coming weeks than we had initially anticipated, or those sites will be able to do more. So just for this week, we're at 93% of where, at this point in time, today, that may well have changed by later in the week, but my recollection is 93% is an A+ anyway.
So are you really saying that 100% was more a model rather than a target?
Correct. It would be 100% of what had been modelled out for this week. But again, as each day goes by, and as the Minister's pointed out, by next Tuesday there will be 50 sites around the country and increasing beyond that.
23 people who
Up the back.
Oh, so applications open in a week, but so when do you expect the first vaccinations for urgent travel to happen? Have any happened early?
No, none have happened yet. Ultimately, it'll depend on when the people need to travel by as to when they would get access to the vaccines.
And on vaccinations, has there been any discussions on changing MIQ rules for people who are vaccinated coming back into New Zealand? Because in other countries, they're starting to halve the MIQ time. What's happening for us?
So at this point, no, we don't have any plans to do that. That is one of the things that we'll keep under constant review. So there are also other issues that we will keep under review, like requirements around air crew travelling internationally, other requirements at the border. All of those things we keep under review. At this point, we're not making any changes to any of those things, but as vaccines become more widely deployed in New Zealand and around the world, then obviously that opens up space for us to have those conversations.
Just on the I'm harking back a little bit on the Valentine's cluster. Have you, a while back now, but have you got any more leads about how that community case got into New Zealand, or are you following anything up, or is that investigation being discontinued at this stage?
I'll ask Dr. Bloomfield to comment. It's not closed yet because the required period of time has not elapsed since the last case. But I'll ask Dr. Bloomfield to comment on the case, the source investigation.
Yep. So no further leads on those various potential sources of that cluster, and whilst we'll keep open-minded about that, there's no particular possibility that we've landed on. We've really, I guess, drawn a blank on that, and that's not the first time. Of course, in this latest case, we've been able to very quickly, within 24 hours, and again, showing the value of that rapid whole genome sequencing, the team at ESR giving us a very direct link to a specific returnee, and that has huge implications then for what we need to do in terms of our processes from here.
Dr. Bloomfield, you said some of those 23 returnees on that bus have now been classified as close contacts and have to stay in MIQ for 14 days longer.
Correct.
Why is that, when we were told yesterday that on the bus they were appropriately physically distanced?
Yes, I don't have the details of that, but it would be those who were on the bus and sitting close by to the case, and there were 2 bus trips, and it's 14 of the 23 who have been classified as close contacts, just as we do out in the community, and then the protocol is 14 days isolation and 2 further tests. The other 9 are required to stay another 5 days with a further test.
Appropriately distanced, there wouldn't be close contacts.
Yes, so it would be the judgment of the Auckland Regional Public Health team who would have gone through. I mean, they're the ones who make the judgment on classifying people as close contacts or casual.
That would have all been avoidable if the person had simply been transported back separately?
Yes, of course, and that's why we learn from all these events. We review and we learn and we adjust. And again, just to go back to my comments, it's more than inconvenient for these people, and I just want to thank them for their patience, because it's about protecting New Zealanders and preventing any possibility. There's no evidence to suggest they have been infected. Of course, proper infection prevention control, distancing protocols were followed. This is just being extra cautious.
On those protocols, there's been a suggestion for a stand-down period for when a room is vacated. There's currently no stand-down period, and we're obviously looking into the cleaner and how they got infected. Should there be a stand-down period for, particularly when a room is vacated by someone who has tested positive and has moved to quarantine?
So, look, we've looked at this very closely. There is a fogging machine that goes into a room after a positive case leaves there that thoroughly disinfects the room before anything else happens in there, before it's cleaned and so on. So that helps to minimise the risk there. The room is then very carefully and thoroughly cleaned in the event that there's been someone in there with a positive case. The cleaners who do that wear the appropriate PPE and so on. There's very, very good standard operating procedures around that to remove that residual risk. So one of the things, for example, that we've been looking at very closely is that the potential for particles, COVID-19 particles, to remain in the air after somebody has left. That's what that machine is designed to deal with, so that there would be much lower risk of that happening in the event that COVID positive cases left the room and a cleaner goes into it. So there is a pretty thorough process here to keep those people safe. Where there is a COVID-19 positive person who has left the room. I want to point out here that for some of our isolation facilities, they'll go weeks on end without having a positive case in them. And so the risk there is obviously negligible. Others, and if you look at the numbers around the Grand Millennium, big facility, we do from time to time see that there's a flurry of positive cases, and we've got good infection prevention and control measures to stop that being spread.
So does it sit well with you, Dr. Bloomfield, that Māori...
Well, a stand-down period wouldn't add anything extra, because those rooms are very, very thoroughly sanitised, with fogging and then with very thorough cleaning before anyone else goes into them. Yeah.
Does it sit well with you, Dr. Bloomfield, that the Black Caps will get early vaccinations ahead of the likes of Māori and Pacifica, who face great risk when it comes to COVID-19?
So I think 2 things here. First of all, as the Minister pointed out, the numbers will be small, and so we will be adamant that vaccinating anyone who is being vaccinated because they've met the compassionate grounds or national interest grounds will not be preventing others from accessing the vaccine. It will not be thousands of people that are meaning others are deferred. Secondly, I think if you look at the sequencing framework, and we gave advice on this and Cabinet's made its decisions, we have seen a big group in that tier 2 and 3 that are those people with pre-existing conditions and our older people who are brought forward into that and will be starting to receive the vaccine from next month. The other important thing here is that the approach is been very clearly communicated to all providers that if someone is in one of those categories and comes in to be vaccinated and they have family or whānau members with them, and the opportunity is there to vaccinate family and whānau, then that will happen. So they're not bright lines between each of these groups. There is flexibility there to make sure that our high priority groups, the groups that would do worse if there was an infection in those whānau or in those communities, they are able to be vaccinated when the opportunity arises. So, and we have great confidence in our providers, and that's something that's already happening now.
All right, last couple of questions.
Do you still think it was appropriate that those people, for this bus case, that those people were put on the bus with someone who was COVID-19 positive and who officials knew was COVID-19 positive?
Look, that's the standard operating procedures around that are being reviewed, and I'll get a report from MB, the people who run those services, in due course. I would point out, though, that the exposure could have happened before the test notification was received.
How would you feel if you were put on a bus with someone who had COVID-19? You didn't know it, the people who put you on the bus knew it, and yes, you'd been on that bus earlier, but now you were being sort of knowingly put on that bus. And sure, you have social distancing and masks as well.
Look, I would be disappointed, as I'm sure the people who are in that position are disappointed. I am disappointed for them, and this is something that we'll look very closely at to ensure that we minimise the potential for it to happen to someone else again.
The rule change at MIQ, going from 90 days to 6 months, there had been people who had been planning vacations for 90 days. There has been the suggestion of some people using MIQ facilities here as a stepping stone to Australia. 6 months seems a pretty excessive vacation. Are you suggesting then, is the idea then that this is a de facto rule that you don't pay, that you should pay unless you're moving back permanently? And if that's your thinking, why not just make that the rule?
This is to ensure that New Zealanders who are coming home are coming home. They're not coming here for a holiday, for an extended holiday. That is absolutely correct.
You've been seeing a lot of evidence of that?
Anecdotally, but ultimately, this will help to ensure that that's not happening.
The national significance category will mark the first time that the Prime Minister or yourself or other ministers are eligible to receive the vaccine. Will you be vaccinating yourselves with the vaccine?
Well, I'm not going to administer it myself, if that's what you're asking. But
will you be taking up the offer so you're ready to go overseas should you need to represent New Zealand?
Look, this has occupied a lot of our discussion and thinking, because we've been through this before here. The dilemma that we've got is obviously we don't want to be seen to be jumping the queue. We don't want our political leaders to be seen to be jumping the queue. On the other hand, we are getting questions from people along the lines of, well, if this is a very safe thing and you're backing it, why are you not doing it yourself? And so we have to balance those two things together. We will make some decisions fairly shortly about that. It's likely that you'll see different groups of our elected officials being vaccinated at different times, some earlier than others. And we'll have more to say about that fairly soon. But yes, the national interest criteria there is it doesn't actually fall within the criteria that I have just set out here, but it is something that we are very mindful of, that need for political leaders to be able to show leadership, and we're working our way through that. But like I said, we're also balancing that against the fact that there are a lot of pressing calls for people wanting to get early access to vaccines. Yeah, but also we don't want to be seen to be getting too far ahead of it. So we're working through that. We're still talking about that. We'll have more to say on that.
Dr. Bloomfield, are you trained to give the vaccine?
If I was to give the vaccine, I would need to have completed, like every person who is giving the vaccine, the online 2-hour module specifically about this vaccine. I'm not intending to, but I am intending to make myself available to support the vaccination efforts, because there's a real team that's needed. So I'm looking forward to, perhaps a bit later in the year, supporting one of the teams that's doing the vaccinations at one of the clinics at some point.
All right, that seems like a good note to wrap up on today. Thank you, everybody.
Thank you.